It's quite hard to speak about the medical tyranny that has beset the land in the past, oh, probably 100 years. I don't wish to be critical of doctors and nurses because I'm sure they are working earnestly and they believe that they are doing a good job. However, people don't consider the fact that most people die because of some kind of a medical procedure. It's called iatrogenic illnesses. And ultimately, the cause of death in the Western world is in the hands of the doctors. Now, of course, people will die anyway, but when one starts taking this drug and that drug and then another drug, one after the other, as one ages, and then various surgical procedures and so on and so forth, inevitably, people will die through complications from the treatment that they are receiving. So, hospitals really have become, or have always been perhaps, temples of Baal, where death is celebrated on a spiritual plane, on a spiritual plane, and it's unconscious, of course. I remember when I was asked or recommended to go for an MRI scan. The only time I've ever done something like that, I would never do it again. And I noticed that the imaging department in the hospital, my local hospital, which is full of, modern equipment and worried people, is sited right next door to the grief counselling or the counselling department. And the other place that I always like to go when I go into a hospital, which I very rarely do, but I have been, is the chapel, because all hospitals have a place of worship, and these days, of course, they will be mainly frequented by Muslims and Hindus because very few Christians go into a place like that. And when I went, there were two nuns in the corner whispering and whispering and whispering, and I was reading from the Bible quietly. And I was alone, of course. It was quite a large complex, or a large room, really, in the centre of the hospital. I always like to go there to see what's happening, the prayer centre, the worship centre. And you'll find them in hospitals and in airports, and I think they're always worth a visit, just to see what's happening. But hospitals really have no basis. Their purpose in healing trauma is excellent. The standard of trauma care, I think, in this country, I have received it myself. But a lot of the other stuff, or most other stuff really, is absolutely damaging and unnecessary. And people wind up in hospital really after having neglected a disease for a long time, and then doctors will give them medicines which alleviate the symptoms, and so they let it slide, and of course eventually they become incurably ill, and then the hospitals and the doctors will roll up their sleeves, and then this is the savings of lives. These are the ambulances racing around in their missions of mercy, and people put their lives in the hands of specialists and registrars, rather than laying them before the our Lord and Saviour Jesus Christ, who is the arbiter. They are in his hand always, but this, of course, is not recognized. And so people come to worship the life-giving doctors, and the praise that I hear for these people, and the amount of um, it's really obeisance. They only have to speak, and people will say, well, they want me to do this, they want me to do that. I've heard it so often. They've had me doing this, I've got to do that, I've got to do the other. No, you haven't. They've told him that, it's a terminal illness. What right have they got to make those kinds of pronouncements? To define, I've got this. No, you haven't. I've got that. No, you haven't got that either. You have illness of some description, perhaps. Perhaps it can be cured, perhaps it can't. But the remedies are in your own hands. You don't have to give them to a doctor and start taking pharmaceutical drugs. They will always be bad for you. Any surgical procedure, they'll always be bad for you. So they should be avoided at all costs, except in the case of trauma, of course, because if one has a broken leg, then really the hospital and the doctors and nurses will do a very good job. Perhaps a bit too technical. I think there was very good orthopedic care has been available for a long time. There's, again, the healing skills have been lost. The healing herbs and the healing skills have been lost and replaced by in semi-industrial processes. And maybe they're better, I don't know. I mean, this is something that I'm certainly not qualified to make that call. I broke my the metacarpal bone in my left hand, and the surgical procedure that was required because the bone was not properly aligned. They told me in the hospital they would put in these Kircher wires, which was to be a temporary fixation of the bone, and that was a surgical procedure to insert them. And then after a couple of months, another surgical procedure to remove them, fortunately, so I don't have them in my hand any longer. And I will say that everything went very smoothly, very professionally. The use that I have of my hand is absolutely wonderful. I suffer no restriction after quite a serious break, actually, because my thumb was completely unusable. So, I praise them for their orthopedic care. Whether or not such a thing could have been achieved without Kircher wires and without that complex surgery, I don't know, and I wasn't prepared myself to risk trying it. And I prayed about this quite a bit. But it may be that bones will set correctly if they are treated properly externally, because the hand of God can be upon that kind of healing. The trouble is, you see, that in the movies and in literature, always doctors and nurses are described as heroes, and they are the people that rush in and save the day. They've been drumming this into people for ever since mass media became a thing and the films and everything. The ambulances rush in, the experts, the highly skilled specialists come in and they save the day and they fix it all, and it's a wonderful thing. I don't mean to say that it never happens. I think it probably does happen. I'm sure that people who are involved in motor car accidents and serious trauma have good reason to be grateful for the medical care that they've received, as I am. But when it comes to internal illnesses, these heart bypass surgeries and arterial problems and problems with the liver and problems with the pancreas and problems with various organs, and they'll say, well, there's a tumor, there's a cancer. These these things should not be at all. There's only one state in terms of illness, and it's just the fact that one is not well. And then, based on those symptoms, using herbs, adjusting diet, changing habits, praying earnestly will cure so many things. We can be healed without having to be cut. And indeed, when we are cut, I'm afraid to say, it's generally not going to be very good in the long term, in the long run. So I'm very much opposed to the medical system, and as I said initially, I'm not opposed to individual doctors and nurses. I think some of them do a great job and a very difficult job under a great deal of stress. But it's an economic system. This is the problem, you see. When my Italian mother-in-law she had a string of medical problems, and she was in and out of hospital. But her problems really were emotional, I think, in the main. But they became physical, and she had renal failure. And I spent some time in the nephrology, it's called in Italian, the kidney unit. And I noticed how much advertising they had there, that how good it would be if everybody should focus on renal health, and look at this and have this test and have the other test. They're generating an income stream. You go into hospital, you have your tests, you have your colonoscopy, you have your various blood tests and internal examinations that they can do, and they urge people to have them. Women having the pap tests and all these things. And of course, this is the beginning of an income stream. As soon as somebody can be treated, they bring them into the system, and then money starts to change hands, and there's a churn in the economic system. People don't see it because they'll say, well, it's free in this country. Healthcare is free. I know in America it's not. But in this country, you don't have to pay anything at all. It's much better here from that perspective than it is in Italy, where there is a basic charging level for many types of procedures. Whereas here, most of the time, it's completely free. Just do it. It's free. Gentleman that one of my neighbours had surgery on his eyes, cataract removal, and it was a laser process. And he was enthusing. He said, yes, he said, I think I can see a bit better now. I think it will clear up, and perhaps it would. And he enthused. It's a good idea to go and check it out. It's free. He said, it's free. You may as well do it. I wouldn't dream of it. I wouldn't dream of it. There are many ways of looking after our eyes. There's no reason why our eyes should fail before we die. Of course, they will dim, but that's physiological. But our bodies are perfect, really, and if we look after them correctly and eat well, then many types of illnesses and diseases can be warded off without having to go at all to any form of doctor. I mean, a doctor is just somebody with a postgraduate degree. So you've been to you've been to college for maybe 7 years, maybe 8 years in some cases. It's quite a long and grueling course, and it's quite competitive, I think. To become a doctor used to be seen as a meal ticket. I think these days doctors are not getting quite as much money as they used to, but it's a prestigious position, and they call you a doctor. And a doctor is just means somebody with a postgraduate degree, with a PhD of some description, or um, that's all they are. They're people who've been to college for quite a few years. Um, if you're ill, what you need is a healer, and it's almost impossible to find a healer, of course, because now healers, they're not allowed. The state has the monopoly on healing. One can't say, take this herb, use this remedy, because the state will say, well, that's you are a charlatan, you are a charlatan. And if any doctor does any such thing like that, or mentions that there are alternative remedies, they will risk censure, and there will be repercussions. It's a coercive system. They have to sing from the hymn sheet that they are given. They're not allowed to think for themselves, or I suppose within fairly broad parameters. But their job is to feed the healthcare system and to push patients through it. And people go willingly to the slaughter. They go very willingly. The doctor said this, so I'm going to do this. Well, the doctor says, I've got that. Well, have you? What is it? They're just names that they've invented. Of course, you can cut open the body and find all sorts of strange things, but the body can heal itself also. But it's not going to heal itself very well. If a person is stressed, thinking that they have a terminal illness, or thinking that they have a serious illness, and of course there's a lot of anxiety involved, and anxiety causes all sorts of bodily reactions. I'm very much opposed to the whole healthcare system, and I would far rather visit a healer if it comes to it, or as I have done throughout my life, I try to inform myself to see what's wrong with me. But latterly, over the past 10 years, more or less, I have rejected any kind of medical treatment, and I haven't needed it. I've avoided 2 surgical interventions because I just didn't want to have them, and I'm still fine. In fact, I'm sure I wouldn't be quite so fine if I'd had them. One of them was an inguinal hernia. An inguinal hernia where they'll put in a plastic mesh to make sure that to sort of contain it by some kind of a mechanical system. Well, I didn't have that. And sometimes I do get pain in the inguinal area, but most of the time it's fine. And I treated it with knit bone. Comfrey is a very, very powerful herb and will penetrate through the skin and can heal internal parts. It can. These are the herbs of God, and yet people don't know of them. I mean, maybe they do a little bit more now, but generally speaking, they're not used. It's a sad state of affairs, is it not? So, may all the doctors and nurses anyway be blessed and praised, and may they be comfortable in their lives, and may their patients perhaps think twice before consigning themselves into the hands of what is perhaps the biggest private company in the world, I think, which is the National Health Service of Great Britain. It is absolutely massive. And ultimately the hands of the pharmaceutical companies, of course. There's so much equipment and kit that goes in here with, I'm sure the Kircher wires that were put in my hands will be very, very expensive. And all the instruments that were used to do that and the procedures and so on and so forth. Now, of course, um, I had a blocking anaesthetic to be able to have that operation, and that worked extremely well. And I'm very grateful for it. There's no way that I could have. There was no possibility of being able to have an operation like that with no anaesthetic. That would be absolutely unthinkable. But I tried to be not to be too extreme because I've had that experience, and I think it was very helpful for me to see it. And during my surgery, because I was awake, fortunately, I chatted to the surgeon and I mentioned that we live on a flat earth. He seemed to be quite interested to hear it. This was going back a few years now. Whether that stayed with him or not, I don't know. God bless and good night, everybody.